We continue to see high rates of infection and increasing rates of flu, almost all of which is H1N1. This acts very much like other types of seasonal flu, of which it is simply one variant. And what that means is that most people can take care of this best at home. So stay home if you have flu symptoms. And what do you need at home? Well, you need a thermometer. You need over-the-counter medications, ibuprofen or acetaminophen. You don't want to take aspirin, particularly for children. Aspirin is not a good choice for fever or for aches. Nasal decongestants may be helpful for some. You want to take a lot of clear fluids. And with those, you're going to, in most cases, be just fine. It may take 3 to 5 days for a fever to subside, and you then will have more respiratory symptoms, could be coughing and bringing up some stuff. But for most people, that's going to be fine. And not going to the hospital is, in those situations with mild or moderate symptoms, is a good idea. Don't go to the hospital if you have these mild or moderate symptoms, because you're going to wait a long time. Emergency rooms are quite crowded, and they're not going to be able to do much more than this, except that in the very early stages of this illness, you could speak to your physician and find out whether your physician recommends that you get an antiviral medication. There are two. One is Tamiflu, the other is Relenza, and what they can do is to reduce by a little bit the time that you have these symptoms, and can sometimes give you a milder case than you otherwise would get. So check with your physicians at the beginning, but in terms of what you can do for yourself, these are good options. The antivirals are by prescription only. On the other hand, if you have an underlying medical condition that puts you at higher risk for the complications and you start to get flu symptoms, for those individuals you should check with your physician right away.